could, but you tweak it over time. All right. We're live. Good morning, good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Olabintan. I'm the CEO and co-founder of Livingspring Family Medical Center, where we help patients live long and well because we believe the quality of life is just as important as the quantity of life. And we're having conversations today in line with what we believe. And the topic today is, Doc, I have sickle cell disease. How do I thrive? Please and thanks. I have to be honest with you and share this first before we go ahead. This is a topic that's very near and dear to my heart. I have loved ones who have struggled with this disease and also clients as well. And so I'm really honored and thankful to have you, Dr. Toyosi Onwuemene. I hope I did not butcher that. To have you on with me discussing this topic. So thank you, Doc, for coming.
Thank you for having me. It's such a pleasure to be here. Thank you.
Thank you, thank you, thank you. Now, for those of you who are watching live, hashtag live. For those of you who will watch on replay, hashtag replay. And that being said, Doc, can you introduce yourself? Who are you and what do you do?
All right. So I am Dr Onwuemene. I am a hematologist. That means I am a blood disorders doctor. And I have been a hematologist now for the last 10 years of my life. I have been in medicine for about 20 years. And how did I get into hematology? So I had a mentor who was a doctor for patients with sickle cell, and she really got me started on my love for hematology. And so I care for patients with all kinds of blood disorders, including sickle cell disease. And it's just exciting to be able to help people live better despite and in spite of their disease.
Awesome. I like what you do. And, I'm starting to see a pattern. The role of mentors, like who you watch, is a big deal. But thank you for sharing that story. And now we're going to dig right into it and talk about sickle cell disease. For those who are watching, who are like, okay, what's that? What is sickle cell disease and how does it affect the body? Why is that a big deal?
Great. Thank you for asking that question. So sickle cell disease is a problem with red blood cells. So in our blood, we see our blood, it's red, but it has so many components to it. And it has three major blood cells to it: the platelets, which help us to stop bleeding; the white cells, which help us to fight infection; and the red blood cells, which help us oxygenate the body. That's the red blood cells deliver oxygen all over the body. So sickle cell is a problem with the red blood cells. And there's a mutation in the red blood cells that doesn't allow them to be flexible and springy and deformable like sickle cells, like regular red cells are supposed to be. So red cells are supposed to deliver oxygen throughout the body in the smallest nooks and crannies of the bodies. But before they're able to do that, they have to flex and get small and squeeze through tiny spaces. So when sickle cell disease happens, when there's a mutation in one of the proteins that is important for red blood cell shape, the red blood cells become rigid and hard. And that means they can't easily pass through to deliver oxygen where they need to. And this tends to happen to the red cells when they become deoxygenated. So conditions that cause the red blood cell to lose oxygen allows the red blood cells to become rigid. So they get stuck trying to pass through to deliver oxygen. So two things happen. Number one, they can't get to the tissues that they're supposed to be supplying oxygen to. So those tissues are ischemic, and that means that they're not getting oxygen. So they actually do start to die off a little bit at a time. And then they're also blocking the way. And so other red cells are not able to pass through. So they cause inflammation as well. So the problem with sickle cell disease is primarily a problem of pain because this tissue is dying because it's not getting oxygen, but it's also a problem of just chronic inflammation and chronic damage to the organs. And so it can be a really, really problematic disease throughout a person's life.
Wow. I like how you break it down. And explain how it functions and why it causes what it does. And that being said, what are you mentioned pain, but what are the other maybe common symptoms of sickle cell that you tend to see? I've seen the top 3 or 4. And how can they be managed? That's a really question.
Really, really important question. So yeah, I talk about pain because pain is kind of like one of the most obvious manifestations of sickle cell disease. But the pain is really just a symptom of what's going on in the body. And so, as I talked about, these red blood cells are blocking the way, oxygen is not getting to the tissues. And so there's ischemia. These tissues are dying off a little bit at a time. And so that means that organs are getting a little bit of damage each time. And so what you start to see is different manifestations of organ damage. And so for some patients, that's kidney damage a little bit over time. For some patients, that's damage to the lungs because sickle cells can go there and get stuck in the lungs. And so some people will have trouble
Mhm.
breathing over
Mhm.
time. And really, honestly, that's damage to the brain as well if sickle cells get stuck in some of the blood vessels in the brain. So, but it's a little bit each time. It's a little bit each time. And so when you really start to see the problems with sickle cell disease, it's over a lifetime of having had all these complications. And so in terms of trying to manage it, our goal is to prevent these red blood cells from deoxygenating and getting brittle. And so many of the therapies we give, many of the things we ask people to do is to just prevent stress to the red blood cells. And so that we can break the cycle of sickling. And many of the medications too help patients to do that so that we can prevent the chronic manifestations over a long time.
Wow. I'm glad we're having these conversations because the pain sometimes, just in observing and people who suffer with this can be pretty debilitating. And I'm glad we're having these conversations because sometimes these conversations are not being had about how detrimental it could be to the patient who's struggling with this. I've had encounters where patients come to see me and say they went to the ER and they're like, "Here's ibuprofen or Tylenol." Can you just shed a little bit light as far as the intensity of the pain that this, because you said it's ischemia, that means tissue death. And the way your body screams when tissue is dying is pretty intense. So as someone who sees this pretty regularly, can you shed a little bit of light on the pain, like how bad the pain could be?
Yeah, so sickle cell is one of the pain syndromes. And so it's one of these diseases that causes terrible, terrible amounts of pain. And I think the first thing I want to say is to people who love people with the disease or people who care for patients with sickle cell disease, in reality, it's horrendous pain. And I think it's pain that people don't always understand, can't understand. And it's really important that people just have empathy, really, really have empathy. Because, I talk about ischemia and I talk about there's pain in the organs that are dying off, but a lot of the pain is bone pain. And that is intense and horrendous pain. So as a hematologist, I do bone marrow biopsies where I have to go through people's bones to get access to the bone marrow. Whenever you're passing through bone, it's so sensitive. It's got a lot of nerves to it. And so it really, 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 really gets the pain is intense and it's very exquisite. And to be honest, it's very hard for patients to describe how intense the pain is, but it's pretty bad. And the challenge with the pain is that there is not a pain meter that's external and
Mm.
objective where you can be like, yeah, you have pain, or no, you don't have pain. And so it's difficult because in a sense you have to trust people that when they tell you they have pain, they have pain. And it's really important because it compounds. And so if you don't address sickle cell pain, then it gets worse and it gets worse because what you're doing is it's just a cycle of ongoing red blood cell sickling, and you really do want to break the cycle. So the first thing I want to tell people who care for patients with sickle cell or who have friends or family members, you've really just got to empathize with the pain. It's so important. And then definitely for providers, it can be challenging because we like to fix things. And when someone
Right.
comes into the ER, they say they have pain and we give them ibuprofen and Tylenol, which is what we like to do. And they don't get better. We're like, but why aren't you better? And I give you oxycodone and you're not better. Why aren't you better? It can be frustrating. And so
Mm.
patients with sickle cell are not just coming up against needing to manage pain, but coming up against really bias and discrimination in the sense of like we have a hard time managing pain when you don't have a disease like cancer. You're like, well, you don't have cancer. Why do you have pain? So it's a challenging thing. So there's emotional pain associated with that too. All sorts of pain.
Wow. I like how you break it down. I'm glad you're on this show. This is good. And so on both sides of the spectrum, patients have to advocate for themselves, and then we as clinicians and those who care for those who have sickle cell can be a little bit more empathetic and more understanding that the level of pain could be something mind blowing actually. Now that being said, I always like to steer our conversations where we talk about ways we empower our patients. So, granted, the disease is there. We talked about, of course, meeting with your doctor to go over what the customized plan would be for you. But what are things in the day to day that someone who has sickle cell could do to minimize the risk of a flare? Now, what would you
I
say to
love
that?
it. Thank you for asking that question. I was waiting for you to ask that. Okay, so first of all, I want to tell everyone who's listening who has sickle cell disease that you are not your disease. You are a person who has a disease, but you are not your disease. And so you are in charge of your body and you're in charge of your care. And so the first thing I think that's most important is that people take ownership of their experience. It's not the doctor in charge of your care. It's not your family in charge of your care. It's you. You are the leader. And the great thing is that you have a team. And so I hope that every patient with sickle cell, first of all, has three people in their team. Number one is them as the leader of this team. Number two is their primary care provider as their quarterback, helping them make good management decisions. And number three is their hematologist, who can work with their primary care provider to make sure that if and when a pain crisis hits, they have all the resources they need to manage it at home. And if it's beyond something that can be managed at home, when they get to the emergency department, they have resources for someone to vouch for them and say, yes, this is the plan we've come up with to treat acute flares of pain. We do want to execute this plan. And it's really, really important. So number one, you are the leader of your team, and you're going to work with your primary care provider and you're going to work with your hematologist to make sure that the plan is solid. So what are things you can do by yourself? Number one, take care of yourself. This is so important. It's like the most important thing possible. Your body is your body, and you're in charge of making it as healthy as possible. And so, what does that look like to prevent crises? Number one is stay hydrated. Number two is stay away from stressful situations. And number three, avoid the extremes of weather, because changes in the weather can also kind of precipitate crises as well. And so these are things you can do. If you live in a cold climate, stay warm and make sure that you just are nourished in every way. People who stress you out, people who cause your blood to boil, you need to avoid them like the plague because they're making you unhealthy. So those are the kinds of things that you can do. Now, staying hydrated is important every time, but especially when you have a crisis, making sure that you're hydrated and you have access to good oxygenation. For some people, they actually do need oxygen, but for the rest of us, making sure that we're always taking good deep breaths so that the whole lungs are oxygenated. Sometimes in the hospital, we'll give people like an incentive spirometer so they can take good deep breaths. When you're in pain, it's hard to take a good deep breath, but those are the kinds of things that are important. Now, if you have an acute crisis that you can't treat at home and you get to the emergency department, this is where your whole team comes together. It is so helpful to be able to say, I've already talked with my primary care provider and the hematologist. We've made a plan. This is the way we treat me when I'm in pain. So for some of our patients, when the doctors don't believe them, like they'll say, pull up my plan. It's in the plan. And so the docs who are in our system can pull up the plan. But for those who are not, they'll say, call my doctor. They will tell you the plan. And that's why it's important that you have a great doctor like Dr. Olabintan to help create a plan for you, be your quarterback, so that when people call and say, we have this patient in the ER and we don't know what's going on, she can vouch for you. And so I think those are the things you can do. You're leading this team, but you're also working with your team and you're doing everything you can to stay healthy.
Awesome. Doc, I'm trying to write notes and comment here so people can see what I'm saying, not miss all the juice that the other like gold you're dropping. Having a team, not rolling over and playing dead. Taking ownership, advocating for yourself. Sometimes you have to do that because remember, it's your life. So be encouraged. Staying hydrated. I have to say, Doc, this one's a little tough. I've had patients tell me, Doc, I feel like I'm drowning with the amount of water I am drinking. Can you shed a little light on why and how that helps? Maybe it would help encourage more consistency in staying hydrated. Let's chat a little bit about that, Doc.
Sure. So, one of the important things is for the red cells to avoid becoming deoxygenated, because when they become deoxygenated, that's when they sickle. And one sickle cell leads to the next sickle cell, and it starts off a cascade of sickled cells. And so, one of the ways that you keep red cells from becoming deoxygenated is make sure that they're nice and hydrated. right? If red cells are dehydrated, then they tend to become deoxygenated and they can sickle. And so staying hydrated is important. So in a sense, it's a responsibility and it's an obligation to your red blood cells to keep them nice, juicy, and fluffy. So think about it. Every time you're taking a drink, and it doesn't have to be water, but avoid the kinds of drinks that can dehydrate you. But it doesn't have to be water. But whatever you do, what you want to do is each time you drink, you're thinking, I am making my red cells juicy. I am helping them stay hydrated. I'm helping them flow beautifully through my body. And just think about just words of affirmation that you can use even as you drink. So drinking is not just drinking to be like, oh, I'm trying to drink water, but it's really drinking to say, look at what I'm doing. Look at how I'm nourishing my body as I drink. And so whatever you can do, whatever things you can do to help you reframe the way you think about hydration, definitely do that.
I love it. It's a responsibility. Today, I'm going to get my red blood cells moving. I love it.
That's
And I like that you mentioned that it's not just water. I tend to encourage things like watermelon and cucumbers, foods that are very
mm,
high in water, so that way you don't feel like you're stuck to just drinking water. Now, my next question to you is this, Doc. And we already talked about it earlier on how can we empower caregivers and loved ones of those who have sickle cell disease on how to better serve their patients or their family members,
I
I'm sorry,
love.
their loved ones. Like what are tips for them?
Absolutely. This is a really great one because you know what? It's a team effort. And the patients who succeed and do well are patients who are loved and supported all over. And that includes having a great team of providers, but having family members advocate for you as well. So one of the things I do as a hematologist who's on call for my hospital is I get calls from family members who will call the physician on call. And many times they will call on behalf of the patient. It's not the patient, it's them. They're like, no, my sister is in too much pain. She can't even talk to you. So I'm calling on her behalf. What should she do right now? And so that's important. So if you have the number of your hematologist, your primary care provider, make sure that's provided to your family members. Make sure they have that number to be able to reach them to ask for advice when needed. And we physicians, we're here to help. And so sometimes it's asking my patients' family members would say, I'm not sure that she's getting the right treatment in this emergency department. Doc, what do you recommend? Do we leave and drive elsewhere? And sometimes I've asked people to say, put the doc on the phone and let's make sure that you're getting the right care that you need. And it's family members who are making that and advocating for patients. So I want to just say thank you to family members who are caring for our patients with sickle cell disease. You are so critical in this fight. You're so critical in the mission. And sometimes when people are sick and they're not feeling good, it really takes someone else who's loving them to say, you're not looking so good. We should get you the help that you need. Sometimes when you're in so much pain, you can't even think about that, but your family helps you, and your friends can help you do that. So yes, caregivers and loved ones, you are a critical part of this journey. And I want to thank you for every time you invest in helping your friends and loved ones do well.
Most definitely, most definitely. And then to piggyback on that question, are there resources? Because you could Google search and um, I find Google searches a little bit dangerous if they're not guided. But are there resources or links or things that you can generally, for those who are watching, subscribe or recommend for people with sickle cell and their families?
Absolutely. So I think one of the biggest resources, other than your care team, which you almost always must have one, I'm going to pause again and say you got to have a care team. And I think patients who get the best care have a primary care provider who knows them by name, who sees them regularly and can help advocate for them. So if you are a patient with sickle cell disease, you transition from a pediatrician and you don't have a primary care provider,
Mm,
you need a primary care provider like Dr. Olabintan to help you with your care. So absolutely, that's the first thing you got to do is get the team together. That's important. The next thing is to look for people who are like you, who are experiencing sickle cell disease or have family members who have sickle cell disease. So you want to make sure you are in community with other people who have similar challenges, because what that helps you to do is to normalize the experiences you're having. And then in your community, people can say, yeah, that ED at 8 p.m., don't go there today. Go to this one. Those kinds of things, to just the kinds of inside info that people can give you to say, okay, this is a person who's an advocate. This is where you want to go. This is where you want to be. And those are the kinds of things that help you. So I would say better than Googling, better than looking for like different resources is finding people who can support you on this journey. It's such an important journey. And that the same for patients and their loved ones as well. So I think people are the biggest resources, and there are advocacy groups as well. And so finding your local advocacy group chapter, or creating one if there is none, so that people have the support and the love that they need.
I love it. Find one or create one. All right, that's good. That's good. Find one or create one. Doc, this has been so good. We're definitely going to have you come back. Usually I have my guests come back in a couple of months to kind of discuss maybe a part two. But I have people who are watching who are like, I like the way you explain things. I like the way you explain the disease in ways that you can understand and empower your clients. And they're wondering, Doc, where can I find you? Because I want you to come talk on my platform, or because I want to connect with you and learn more about services that you offer. I just want to know you. Doc, where can people find you?
Thank you for asking that, Dr. O. Yes, so I am a hematologist who loves for people to understand hematology. I think hematology should be accessible to all. And for that reason, I have a YouTube channel called Coag Coach, where I share a lot of detailed information about different hematologic issues. And if you make a special request for a video you want to see, I will make one for you. And for the most part, a lot of my videos are geared towards providers because I want to support them as they care for their patients. And so, but if there are any special requests for videos that can help patients understand better, I'm happy to help make that and put that on my channel. But one of the things I do is I'm a coach actually for clinicians who want to build research programs, whether or not they have a research mentor. And part of doing that is saying there's so much we don't yet understand in sickle cell disease. There's so many transformations that still need to happen. And it's not going to happen with us doing the same thing that we've been doing for so long. It really is new ideas need to come, and so that people's lives can be transformed. So that's one of the things I do. So if you have a physician, a clinician who's like, I have this great idea for how patients are gonna be, lives are gonna be transformed in this area, but I'm looking for a coach who will help me as I build this research program, definitely have them reach out to me. I'm on LinkedIn, Toyosi Onwuemene. I am on Facebook. I am on Instagram, and I am also available on YouTube as well. So find me any way that you can. I'll be happy to come talk to your group. I'll be happy to share with you in any way that I can.
All right, everyone, you've heard her. I want you to take stock of her name, so that way you know where you're Googling. But I'm putting all the comments, all the links on the comment section as well, so people can reach it even after the fact. But thank you so much for coming. Thank you for taking the time on this Saturday morning to come and enlighten our viewers. I really appreciate you, and I'm sure our viewers do as well. Thank you, Doc.
It has been an absolute pleasure. Thank you for having me, and thank you for the wonderful work you're doing. Your patients are lucky to have you as their clinician.
Thank you. I appreciate that. And for those of you who are watching live and a replay, I appreciate you for watching. Please, I have a big favor. If you know someone who has sickle cell disease who could benefit from this video as an encouragement, simply forward to them or tag them in the comments. They will thank you for it verbally or through their lives. And that being said, if you also are looking for a thorough and a caring and a compassionate family physician in the Mansfield, Dallas area, I am she. Have a good one, everyone. God bless.